Thank you, Alan. Hello, everybody. Some of you I might already know. For those that don't, I'm Lorna, as Alan said. And it's such a pleasure to speak with you this morning. And as Alan's already said, I'm not quite on all cylinders. So excuse me if I may go a little brain foggy, or I might need to sit down. But we'll plunge on and see how we get on. So today I'm going to talk about integrating holistic nutrition into your care for upper and lower GI symptoms. So this is just myself. It's basically a recap from what Alan has said. I also chair the Diet and Nutrition Working Group for the International Consortium. And so it's really a collaborative approach. So a lot of what I do in clinic is also sort of peer consensus of work. I don't have any disclosures at all for this presentation. So let's just start with the overview of what our talk is going to be today. So we're going to overview holistic nutrition, how it fits into your clinical care when you are an EDS or HSD adult. So we're not talking about pediatrics today. And then potentially what holistic issues might be affecting your GI symptom. And then we're going to have a broad overview of what we might be able to do to support your symptoms. What we won't be talking about is holistic nutrition as an alternative medicine approach. So alternative medicine is non-mainstream and it sits outside the care of your conventional medical consultation, treatment and prescribed pharmaceuticals, so the medications that you're on. What we will be talking about is getting an understanding of what holistic is. So it's really just a belief of interconnectedness. And then holistic nutrition is a really philosophy that we're looking at the whole person equation. And it's an approach to clinical nutrition, so another layer on top, where we're enhancing your conventional dietary care that you might get from a medical dietetics clinic or from a registered nutritionist, and then obviously your medical doctors or other clinical modalities. And we're really looking to promote optimal health and well-being. And these are just some images for you to just pause and take in, because it's graphics that represent what the holistic nutrition is. It's mind and body interconnectedness. We're looking at the whole person, and we're encompassing a rounded approach to your diet and nutrition. So holistic nutrition is an approach that considers from a wide lens of many factors. And we start with the very peripheral of your physical, environmental, mind, emotional, and spiritual well-being. And then we add on what we might know about genetics, lifestyle, and diet. And I say what we might know because there's some questions in genetics, so we don't have absolutes. And then we firmly put you as the patient in the center. But we don't only put you as the patient in the center, it's you as a human being. So before being a patient, you're a human. You were born a baby, you may have been born with issues, but you're a human being in the center of this whole myriad. And holistic nutrition is an approach with an aim. So we're aiming to move up the pyramid. We're improving your dietary intake patterns and behaviors, to improve your lifestyle and your lived experiences and routines and habits. And that hopefully is going to optimize your health, to meet your personal goals. And everyone is going to have different personal goals, whether it's medical, lifestyle, work, social, etc. But we're also going to be adding on to that, up the scale, a holistic approach that supports ongoing modalities. That could be your medical doctor, surgeries, medication, whatever else your medical doctor is doing with you in your care, your physio care, and other modalities, which I am sorry has escaped my brain. Oh, no, too fast. We're also looking at optimizing your body's ability to heal yourself. And I use inverted commas because we are technically healing ourselves every second of the day with cellular regeneration. But to maybe let the body be focused on supporting oneself in its innate abilities to optimize the health. And then ultimately, holistic nutrition is looking for preventative strategies. So we're hoping to maybe, and it's a maybe because again, we don't know what's in anyone's timeline, prevent more disease occurrences. So moving on to how this might fit into your clinical care. It's a real caveat that you do have your clinical care. You have your medical care team. You might even have your registered dietitian or your clinical nutritionist that's working with you on your specific dietary needs. And then we look to a broader view. And so your holistic nutrition practitioner will be having specific training in more of the holistic approach. There are some people out there that are entitled to call themselves holistic nutritionists because it's not protected, but they won't have had, or generally won't have had, any significant education, clinical training, or be insured to support you, and certainly not with the complexities of Ehlers-Danlos. So let's start at the beginning of what our holistic approach might be clinically. We look at you as an individual person, so all the black little shapes are general population, and then we put you very firmly in the centre. We highlight you and we look at you as an individual. Now, here I want to just interject that it's not just holistic nutrition practitioners that do this. Your medical doctors do this, because you're not just a number. Everyone that wants to care for you sees you as an individual. It's just a broader approach that's a bit more targeted. So we've looked at you as a human, as an individual, and then we're really focusing on you and your needs as a zebra. So you have the complexities of Ehlers-Danlos or hypermobile spectrum disorders. So we've got you as the human, and then we've got you as a zebra, and then we form our clinical picture. And so we're looking in your clinical picture what has already been your experiences, medical diagnoses. This doesn't mean that you're all going to be having these medical diagnoses that's on the screen, the comorbidities that we're likely all familiar with, but you might look at the POTS and you might, oh, yes, I've got POTS, yes, I've got GI issues. Or you might just say, actually, I'm okay, I've just got the pain and the fatigue. But these are the things that we're going to ascertain in our forming of your clinical picture. And then we consider our holistic overview. So we've got you as the zebra, we've got your comorbidities, your clinical picture, and then we're looking at the wider spectrum of what might be going on for you. So we're trying to delve into, for you, what is your dietary intake? What are your patterns? What's your sleep hygiene like? How much movement do you do? And this doesn't have to be going to the gym lifting weights. It could be you've gone to Jeannie's class this morning, you've done some gentle movement. What's going on for you in your emotional well-being? And everybody will be sitting in a different position there. And it's important to hear where you're at and really listen to what's going on for you. And then this feeds into stress levels. And it's perceived stress, and everyone's going to have different stresses in life and different things that for them is stress. And then the body might respond differently to your neighbour, for example. What's your social engagement like? And this isn't about, how often do you go and party? It's, do you have friends? Do you have social engagement that's meaningful for you? Or are you more lonely? And then quality of breath. Because we have to look at everything with the body of, are you breathing? Are you stopping? Are you able to breathe? Have you even maybe done Jeannie's breath class yesterday, which I did? I'm very disappointed I didn't make your class this morning, Jeannie, if you're there. But what's all these factors going on for you holistically? And then we have to consider the bidirectional interplay. So we have got a really good view of what you are as a human in your own skin, what's going on for you in your life, your medical interplays, and then we have to be really understanding and validate how one leads to the other and the other leads to the other. So it's chicken and egg, what comes first for you? So if, for example, POTS, you might have POTS which then interplays with poor sleep, poor dietary intake, but then poor sleep dietary intake will then potentially lead to worsening outcomes for POTS, potentially. It doesn't mean that it's caused diagnosis, which is very important to distinguish. And then this is the key thing I want people to consider of holistic nutrition approaches fits into your clinical care because it's aiming to promote health and support your chronic health living with hypermobile. So we go up that pyramid again and we're really focusing on that optimizing health. So I've followed Professor Aziz, and I'm really sorry, I've totally forgotten the surname, brain fog. So we've had a really good overview this morning already about gastrointestinal system. I've put this slide here just to re-familiarize yourself with these are the organs in our cavities. And then we can split it into upper and lower. So We want to understand what's going on for our upper GI. We have the anatomy. I shan't read them all out. They're sort of in that circle, and hopefully people might know that you have a mouth and esophagus. And then we have our clinical concerns, and these will very much be things that we hope you've discussed with your doctor. And we're mindful of, and this isn't an extensive list, it's maybe the main presenting clinical concerns. So you might, for yourself, have gastroparesis, you might have swallowing disorders, which hopefully you're seeing ENT for. And then the presenting symptoms that are commonly found, so it's not to say you're all going to have them, but quite likely you might experience some of these all or a portion of the time. We've got those lists of the symptoms, and there's, they're very common, aren't they? And actually general population can also get bloated and get an episode of burping because we're not robots and we weren't made in a factory. And then we look at the lower GI, which is the same again. We have our anatomy, we have our clinical concerns, and then we have our presenting symptoms. And they do cross over, and sometimes you cannot distinguish, is it my upper GI, is it my lower GI, what's going on? So sometimes you've got both. And then we want to focus on what holistic issues might be affecting these upper, lower GI clinical concerns and presenting symptoms. So we're looking at, have you got a lot of stress? Have you got a lot of medication? With the caveat that that doesn't mean it's bad, and please don't stop, speak to your doctor. You might be having an awful lot of highly processed foods. You might be consuming a lot of alcohol. And again, it doesn't mean you have to go teetotal, but be mindful that alcohol might not be your friend with GI issues. And then we're going to add on the more holistic factors of the lack of. So we've had the more of, and then the lack of movement, lack of exercise, lack of quality sleep. So it doesn't mean that, oh, I sleep all day. It means quality sleep. You might have poor nutritional intake, and you could do a whole hour's talk on that. And you might also feel that you have a lack of relaxation, and you might not actually get out to places that you might feel relaxing. I've put on there a little picture of nature. Not everyone's relaxed in nature. Some people feel quite triggered being in wide open spaces with the birds. For them, it might be a shopping mall. Maybe a little sensory overload. We might prefer a park, but whatever for you means relaxation, you might not be having enough of it. And then we want to go back to that original sort of broad overview with all the layers. But instead of you being in the centre, our gastrointestinal system is in the centre. And so just pause on this graphic to understand your gut is in the middle, and we have all of these factors going all the way round that can potentially affect your lived experience with gut health. And we can drill in a little bit more of the triggers, so they're biological, social. So these are the sort of stressors: perceived stress, biological stress, dietary, of course, feeds into gastrointestinal function. And the outcomes might be that we have the glycemic dysregulation. Many of you might have heard it colonially, I think is the right word, called blood sugar regulation, like stabilized blood sugars. So there's many factors that actually biologically will maybe not be quite smooth sailing for your blood sugar regulation. And we definitely are going to be having an impact on our gut microbiota, which Professor Aziz wonderfully explained earlier, so I shan't dig in too much there. We're also going to have an impact on neurotransmitter signaling, circadian disruption, which is our sleep-wake cycle. So if you're, I'm not sleeping well at the moment, maybe there's been an influence on your gut to focus down on your circadian pathways, inflammatory signaling, hormone signaling, DNA damage, which is the cellular recovery, which again could be a whole day's lecture. We've considered our triggers, the gut in the focus, our outcomes, which might actually lead to symptoms. So sometimes we just can't distinguish where the symptoms have come from, but we might experience a lot of this. And I'm pretty sure if I asked you, hands up, who's experienced anything on this list, the room would be like trees. So it's very common to experience these issues some or all of the time to differing degrees. And then we can get stuck in the symptom loop. So in order to, fast forward to how can we help ourselves, we really need to try to understand the fundamentals of what things affect us as a human. Where is this symptom loop coming from? So we have the graphic there of we've might got a little bit too much of the stress, the medications, the processed foods, not enough of the sleep, the exercise, the relaxation, the diet. And then it's potentially leading to our symptoms. The symptoms in themselves can then be in this loop of leading to, you're really constipated and bloated, you're not going to fancy a walk. You might not be sleeping well. And therefore you might not be in a good position, you might wake up in pain, and then you may have some more symptoms. So we've got this loop going on. And the loop is, in part, the gut, the brain communication. It's like a little telephone, and they're talking to one another all the time. We don't know which comes first. Does the brain control the gut? Does the gut control the brain? That's like real digging into neuroscience. Professor Aziz has touched on that this morning. But we have many things that are going to influence this communication pathway. I'm not going to spend a lot of time on the gut-brain axis. There are some fabulous resources out there already and talks that have already been done, and I do encourage everyone to just see if you can understand the gut-brain axis a little bit more. But for the purpose of this talk, we're going to move on to now how can we safely support ourselves when we are, got a symptom flare. So we look at our specifics. We want to reduce some things, we want to improve other things in our little graphics of our holistic factors. Understand this is going to influence things like our digestion, our gut bacteria, positively or negatively, depends on you as your human zebra. Going to influence potential detoxification pathways, so this is our natural pathways. Think breath, expelling from our lungs, our liver, very key, our kidneys, and we're going to poop, we're going to wee. We've got hormone pathways, neurotransmitters, and importantly, the transportation of our blood, our lymph, and our nutrients around the body. So we have our influences which then support our symptoms. And when we really get GI focused, we want to understand where improving the diet helps. So we know in literature and we know in clinical efficacy and observed sort of patient outcomes, in the diet, we're looking to increase fibre, and I'm not digging into fibre, that could be a whole hour's talk, and because fibre needs for everyone in this room is going to be different. So what we want to do is increase the quality of your fibre. We want to reduce processed foods. I'm not going to say take out processed foods, because people are going to be in different journeys. We want to dial down processed food consumption, consume ample fruits and vegetables, take time to eat, and then focus on your chewing. And we take time to eat and focus on chewing for a two-way communication with that gut-brain axis. Chewing is your first start of digestion, gets our juices going. We want to add in to increase daily movement, breath work, and opportunity to sleep. And when we have these set as a good foundation, we're looking to improve our GI functions. And for some people, they might not feel it improves their GI functions, because sometimes it does take time, because there's a lot of moving parts. But what we're looking to do is improve your digestive enzyme function, helps you digest your food better, helps you absorb your nutrients better. We're improving our diversity of our gut microbiota. That then is going to have an onward support to gastrointestinal motility, your secretions, mucosal, blood flow, intestinal permeability that also Professor Aziz discussed, and the regenerative capacity of your gastrointestinal mucosa, which is a phrase to say with brain fog. All of this, we're hoping, is going to reduce your GI symptoms. So this is tagging into what Professor Aziz described as your lifestyle changes. So when we're looking to reduce our GI symptoms, whatever it might be for you, we're looking to dial it down and improve it. And it might not be you notice anything Monday to Tuesday, but July to August you might do. Sometimes it takes a little bit of time. So what happens when we have a symptom flare? Quite often in clinic, people come to see me and they're like, I'm in a symptom flare, Lorna, we have to do something drastic. We need to sort this out. But a good place to start is just pause, and ask yourself a few key questions. It's like a little, I call it your symptom flare check-in. Just check in with yourself. What might have changed for you to trigger this symptom flare? And symptom flares will be different for all of you with lived experiences, different diagnoses. Has your diet changed? Have you been to a wedding and you haven't really considered that actually, yeah, I didn't eat at regular times, I ate a lot more food? Your social life, did you maybe stay up really late? You know, I had a late night last night. I'm quite potsy this morning. I probably will be constipated. So let's consider things of what might cause a symptom flare. Medication. Have you missed a dose of medication? Has something changed in your medication absorption or mechanisms? And this is something to discuss with your doctor. Some medications, maybe you shouldn't drink alcohol when you had a little tipsy bit of wine and forgot. So let's check in with where you're at with your medications. And stressors. Did you just have more stress? Was the neighbour really noisy? Did you get stuck in a traffic jam? Did something at work not go well? What might have been an influence for you? And then emotions. Did you hear bad news? Did it make you sad? Did you get angry over something? Did you have an argument? Or are you just in a period of time where you're just like, I'm feeling blue, I don't know why. This is going to have an effect. I've put in clothing here because sometimes people come to clinic and they're like, I am really bloated, I'm really uncomfortable, I don't know why. And we talk about what have you done lately? Like, do you know, I went and I bought a new pair of trousers. They're a bit tight for me, but I love them. So we consider clothing with GI. And tight bras, sorry gentlemen, tight trousers, anything that's going to impinge that blood flow, it's a consideration. It's not the be-all and end-all, but let's ponder when you're in a symptom flare. And then breath. Have you been breathing well, your normal breathing pattern, or has anything potentially made you sit back and think, do you know what, actually, I've been rushing, I forgot to do my meditation, I haven't had time to do breath work, I've had a cold and I've not been breathing through my nose. So maybe your breath has been influencing how your GI is doing for you at the moment. And then do your check-in and be responsible for yourself. Make the assessment of, should I tag in with my medical care team? And when people think about holistic approaches, often they think, oh, I can do it all without my doctors. This is not the message. It's just the broader scope. So should you phone your doctor and say, I'm having a symptom flare, X, Y, and Z feels different, X, Y, and Z is concerning me, I'm not sure what to do, can we have a review? Maybe they'll want to do bloods. Maybe they'll want to change your medications. Maybe they'll want to put a different medication in to see you through this particular symptom flare. And then we get to what is the crux of the talk, but it's actually really the shortest part, because the overarching theme is to get you to understand that many things affect your gut, and there's many things that we can look at. And I'm not going to drill really into the details as if I was standing here to specifically talk about nutrition, lifestyle interventions for GERD, for gastroparesis, because when we're doing a holistic overview, they all blend into one. So it sort of doesn't matter what your diagnoses are, it's your presenting symptoms. So if most of your presenting symptoms are upper GI, so they're going to be stomach, esophageal, you might have upper GI bloating, you might have a worsening of gastroparesis or slow motility, experience a lot of bloating. We're going to do 3 considerations. We're going to do our foundations, which is sitting in that holistic lifestyle space. We're going to do meal considerations, and then we're going to just consider supplements. So our foundations are, how are we chewing? Can we chew better? And this is difficult for many of you out there because of the TMJ joint issue or many other things that might be going on for you in your oral health teeth situation. But the question is not, can I chew 20 times? It's, can I chew better? Maybe 2 more times is okay for you. Maybe a bit slower. Maybe ask your dentist, how can I improve chewing? Breathing. Just reconnect, am I breathing well? What that means for you. And I say what that means for you is because we're not aiming on everyone doing deep breathing, because for you that might not suit your body. We're maybe not asking you to do fast breathing, slow breathing, because again, that might not suit you. So it's what's appropriate for you. And if you have questions over that, tag into a breathwork specialist. Jeannie's at the back. Mindful practice is the same. Let's just get a foundation of slowing down, being mindful of what we're doing. So we're going to get up in the morning and we're going to think, okay, I'm not feeling great, I'm going to have a shower. Let's do it slowly and mindfully. Let's see if we can enjoy it. Pop a bit of music on, relax. But do what you need to do, maybe sit down, do it mindfully with considered actions. Meditation, which again means different things to many people, and it doesn't mean sitting cross-legged like, It's just slow. have a moment during the day. It can even be when you're sat on the bathroom toilet. Just take an opportunity to breathe and meditate. Count to 10 really slowly. Listen to the raindrops if it's raining. This is meditation. It doesn't have to be strict. Sleep. Let's see if we can get a bit more sleep. Maybe you need a nap. And then hydration needs, which is, again, a huge topic. Everyone's going to have different hydration needs. I know the time's ticking down. I may go over. I'm terribly sorry. Meal modifications, what we're looking at is texture. So let's see if we can get the food to work a bit better for you. We might not even need to change the food, but we want to change the preparation. So maybe make it a little bit more liquidy, softer. This is not a liquid diet. It's your regular meals, maybe blended. So it's in a liquidy preparation, which goes through the GI tract a little bit easier, particularly the stomach. And it's called the small particle diet. We might want to lower fats and manipulate our soluble fibre, which is slightly harder to digest. And it's a phase, so it's symptom management. It just might be a couple of days. We're going to manipulate a few things. And we're going to maybe see if we need to have smaller meals, a little bit more frequently, and limit fasting. So some people that are having symptom flares, like, I'm just not going to eat for the day. This is not really advised for many mechanisms, which again could be a whole talk. What we want to have is a natural fasting window of around 4 to 6 hours. So we want to just see if we can keep to that, but avoid big fasting windows, especially if you have POTS. And then consider supplementation. When I say consider, it does not mean we might need... Oh, did I click it? Oh, no. It doesn't mean we have to jump to taking supplementation. We consider whether, if we are already supplementing, maybe something in the whatever you're taking is not working for me right now. And maybe, just for short phase, a digestive enzyme might help you digest food. Always check with a nutrition professional or your doctor. Sodium alginate is something that sometimes helps some people if you're not taking medication to help things like reflux, that might support, but again, please speak to a professional. And then I've put in ginger there because many upper GI nausea, stomachy things, there's a lot of research about targeted ginger supplementation. But again, if you're someone with many comorbidities, check it's safe and appropriate for you. And then lower GI is actually similar. So the only thing we're going to change in the considering foundations is potty stool. I hope a lot of you have a stool that you put by the toilet to lift your knees up to help stool evacuation. If not, please get one. If your hips and back and spine are suitable, there's always so many caveats. So make sure, maybe you've gone on holiday and you've used a bathroom that's got a different toilet position, and for your lower GI, it's gone, oh my God, I'm not going to evacuate anything for a few days. So use your stool at the toilet to help everything pop out. And then with the meal modifications, again, we're going to do the same things actually, but we're going to really focus on your actual soluble to insoluble fibre types. And then with the supplementation, Professor Aziz already said it, with a lot more of the research than I'm presenting today, but we're looking at psyllium husk, pectin supplementation. Pectin is actually the natural compounds in apples, so stewed apples will give you the same thing, just not a larger dose. And then in a flare-up, just consider, is this time for a targeted probiotic? And I haven't delved into which one because there's so many, strain-specific for whatever is going on for you. Your GI flare might be diarrhea, which will be a completely different probiotic need to constipation. And then you might all be sitting there going, so a nutritionist is talking about symptom flare, and she's not actually told me what to eat. That is because, please don't jump to food. Don't blame your food, because as hopefully the message I've got over to you is that there's so many other things we need to look at that might be affecting your GI. Yes, food may be the issue, but let's not jump to it. And look at how many people are in this room. This is how many different dietary interventions we'd be looking at if we actually delved into food. And then the closing thought, that is, it doesn't matter where you are in your journey, there's always something, no matter how small, that swings the pendulum, so it's turning the dial. There's always something we can do. And then the closing thought is, you might not have to hug a tree, but go for a little walk, smile, and be kind to yourself. Thank you so much.